My name's Rebecca, I'm 26 years old and I live and work in London as an events organiser. I'm pretty physically active. I like to do anything really, outdoorsy. Horse riding is my passion. I've been riding horses since I was really young. I love it. I do as much of it as I can. It's a great sport and it keeps you fit, and animals are just amazing to work with.
I'm Elaine Davis and I'm from Halifax in West Yorkshire. Before I started reading, I always thought that cervical cancer was something that just an older person would get, but I came to realise that 35 is quite a normal average age for somebody to get cervical cancer. But I didn't realise that cervical cancer was something that killed, because even when you've had something like cervical cancer, everyone says, oh yes, I've had that. They actually had abnormal cells, not cervical cancer. And I think I was the same. I was totally guilty of feeling that that's what cervical cancer was. It was a few abnormal cells that could be cauterised or burnt away, and that will be it.
I had no awareness that it affects young women. I associated female cancers with breast cancer. Cervical cancer wasn't something that was even on my radar. Before my smear test, I didn't really know anything more than once you hit 25, you started having them. I knew that women had them, and I knew they were there to pick up for changes in cells. Other than that, I really knew, actually I knew nothing about cervical cancer, to be honest.
I went on the pill when I was 18, was in a long-term relationship, and I had smear tests every 3 years. I'd always been called for smear tests. I'd had 2 children. I'd had smear tests as soon as I possibly could after I'd had them, and they'd always been clear without any abnormalities.
Previous to being diagnosed, I had no symptoms whatsoever. I was 100% fit and healthy. I led a totally normal life, and I just was not aware that there was anything wrong with me at all.